Hello, and welcome to this overview of the Singapore Allied Health Workplace Learning and Support Framework. My name is Dr. Karina Dancer, and I have had the privilege of working with the Ministry of Health Community Rehabilitation Transformation Work Group on designing and developing this Workplace Learning and Support Framework. So, the intention of this framework is to enhance the workplace learning and support of all allied health workers within our health system. In this video, we are going to share with you these 5 foundational principles of the framework, as well as provide a brief overview of how you can implement the framework within your own workplace. So I hope you find this framework valuable, and we look forward to hearing your feedback. Before we move on to the actual framework, I'm just going to spend a couple of minutes talking about the need for the workplace learning and support framework. And this evolved out of a scoping exercise that happened as part of the Community Rehabilitation Transformation Work Group. And this happened between August 2021 and August 2022. Through the scoping exercise, we wanted to find out what people want from their health service. So we used a design called experience-based co-design, and this involved us collecting interviews, surveys, case note reviews, and time motion or observations from a range of different stakeholders, including clients, caregivers, and allied health workers at all levels. So from these multiple points of data, we were able to assimilate these 4 different areas. The first one was that people wanted best practice care. They also wanted the care to be person-centered. We found out that allied health workers, they also had some support needs and some requirements. And finally, there was a range of suggestions around service design and some of the improvements that could be made there. So from this data, we actually pulled out the allied health workers' needs as something that we wanted to focus on. And this involved looking at the culture change, coaching and support, and career growth. And from this information, we started to formulate the need for the workplace learning and support framework. So just elaborating a little bit more on what the allied health workers' needs were and what people were telling us. There was a range of different areas. So firstly, it was around the workplace culture. People really wanted it to have an opportunity to think, learn and plan within that culture. The allied health workers also have access to quality supervision, coaching and mentorship, and this is throughout their careers, not just at early stages where it's made compulsory. We also found out that people wanted time prioritised for the clinical, the research and teaching work, and maybe there's some reduction in the administrative work. We also found out that the workplace that formally recognises allied health workers' good work and has options for career development and progression was really highly valued by allied health workers. They also wanted opportunities for skill sharing between allied health workers and for those opportunities to be intentional and structured. As part of the experience-based co-design structure, we actually held a range of workshops with clients, caregivers and allied health workers about their needs. And some of the information we shared back from the interviews, surveys, time motion studies and case note reviews, we talked about this at these workshops. So in addition, we found out that around the workplace learning and support guidance, that people are really keen for the ownership of the workplace learning and support to be shared between the allied health workers and their organisations. They also wanted us to acknowledge that there are different modes of workplace learning and support, and that any guidance should not place undue burdens on the organisations. The guidance also needed to be flexible and appropriate to support a range of organisations' needs, so not just to support people within smaller organisations or within larger organisations. It needed to support the breadth of what we have in Singapore. We also found out that the quality of workplace learning and support was a really key factor. They wanted it to be high quality, including skill development, but also the personal development such as supervision and communication skills, and that this should be made explicit. They also wanted clinical education and supervisor roles. It should be recognised as a legitimate part of work practices with that intentional guidance to help equip people with those necessary skills to support others in the workplace. And finally, the learning culture. There was a really strong emphasis on people wanting a positive learning culture within an organisation, and that those that are with more experience also act as role models for lifelong learning. And that smaller organisations, there was a recognition that they might need to band together for some of those learning and support opportunities and to share resources. From that year-long exploration of what people wanted from their health service, we developed a sub-team 2 of the Community Rehabilitation Transformation Work Group, and our task was to really look at those allied health needs. And that's how we came up with this workplace learning and support framework, which we'll talk about next. The purpose of the Workplace Learning and Support Framework is to enhance the workplace learning and support for all allied health workers through 5 essential principles. Now, just to let you know that allied health workers mean that we are including those who are working in support roles as well as those who are qualified as professionals. So the 5 essential principles are that people should have access to workplace learning and support, there should be a learning culture, that workplace learning and support should also include people's well-being, that it needs to be of high quality, and there needs to be continuous improvement. So some of the benefits of having these principles and having these as a foundation in organisations is that it does enhance the well-being and skills of the allied health workers. It also promotes safe and effective practices and ultimately improves outcomes for the service recipients. So the user guidelines, it is a complementary framework to existing learning frameworks within organisations and also complementary to professional and regulatory standards. This is not seen as a replacement. It is applicable across healthcare, including education settings with integrated allied health workers, and we do encourage all organisations to adopt and implement some of these principles. I'll just provide a brief overview of these 5 principles of workplace learning and support, which form the foundations of the framework. So the first principle is access. So workplace learning and support should be available to every allied health worker. The principle 2 is a learning culture. So workplace learning and support is embedded in the culture of the setting and used to drive continuous development and service improvement. The third principle is well-being. So workplace learning and support focuses on helping allied health workers to both do their job-related skills, but also looks after their own well-being. Principle 4 is about quality. So workplace and learning and support are high quality, and there are opportunities to help allied health workers become skilled in roles like being a learner, a supervisor, a mentor, and working together with others. So principle 5 is about continuous improvement. Workplace learning and support are regularly checked, reviewed, and made better to meet the needs of allied health workers and the people who access the services. We've created a 6-step process to help organisations implement the framework. So the first step is to become familiar with the 5 principles, and this can be done through looking at these videos, but also having a look at the framework documentation as well. We then suggest you form a small team, and this team can then complete the organisational self-assessment tool. So this tool is designed to help organisations to see where are the areas where they're particularly strong in, and perhaps some of the areas that they would like to have as a focus. We would then suggest you select maybe 1 or maybe 2 principles to look at in detail, and that depends on where the priorities are for the organisation. So once these have been reviewed, you can then develop an action plan. This might also feed into a quality improvement project. And then finally, step 6 is to celebrate success. And that is a really important step so that we can continue this culture of workplace learning and support and to celebrate the good work that is being done. So this is a summary of the organisational self-assessment tool, and it really does help to focus on which of these principles are something that the organisation wants to see as a focus. So the first one is access, and the questions relate to do allied health workers have access to workplace learning and support regardless of their level in the workplace? Or is it inclusive of training, coaching, mentoring and peer support? And also, do allied health workers know how to easily find and use these support and learning opportunities? And are they knowledgeable about the process of applying for the opportunities, who to seek for help, and appropriate timing of such actions? So if any of those points within your organisation could be something that is going really well or would like to be further enhanced, then maybe the access would be the priority for an organisation. The second one is learning culture. So this is where the workplace learning and support, is it included as part of the performance and development plan of every allied health worker? Does the organisation acknowledge and value workplace learning and support as essential for driving quality improvements? And is there some evidence of how that is happening within some of the learning materials, the supportive leadership? Do you have feedback loops? Are there mentoring and coaching opportunities? Is there recognition of achievements? And is there a way of maintaining regular communication? So those are all some of the key indicators around that learning culture. The third one is well-being. So are there rules and measures in place to ensure the health, safety and support for allied health workers at their workplace? And is there a process in meeting these needs, and is it regularly monitored and tracked? And also, are there training and support programs designed to be accessible and inclusive of allied health workers with diverse backgrounds and abilities? So these are maybe some areas that your team would like to focus in and have a look at what is available. The fourth one is quality. So do allied health workers receive the necessary training and resources to effectively perform their supervisory, mentoring or other supportive roles? So this is really going beyond their job role. It's actually, are they competent in their supervisory, mentoring and other support roles as well? And is workplace learning and support demonstrated to be of good quality, covering all necessary aspects? And the final one is continuous improvement. Is there a method in place to measure the effectiveness of workplace learning and support programs for the organisation? And are both allied health workers and those responsible for workplace learning and support actively engaged in discovering, proposing, reviewing, and providing feedback on opportunities for support and personal and professional development? We have some suggestions about how organisations can apply the 5 principles of workplace learning and support. So first of all, we think that the framework could be used as an assessment, so to evaluate the current state of workplace learning and support within the organisation and identify those strengths and the areas that need improvement. So there's a way of benchmarking. We also feel that there's some alignment that could be helpful within the framework and existing practices. So we can ensure that current initiatives and programs resonate with these essential principles. There's integration, so we can integrate the framework into the organisation's policies, procedures, and also that important culture. So we can ensure it becomes a fundamental part of the way organisation operates. We also feel that the framework can be helpful in communication, so it can clearly communicate that these are essential things that the organisation values and that the members within the organisation have agreed to. So this is including allied health workers, supervisors and the leadership team. This emphasises the importance of the principles in enhancing professional skills and also overall well-being. And finally, collaboration. So it can foster collaboration among different stakeholders, including the allied health workers, managers and organisational leaders. So this could offer a common language so that a collaborative effort can be made to create the kinds of workplaces that are dynamic and supportive, which really helps not only for the outcomes for the people who access the services, but also the health and well-being of the staff involved. finally, I'd like to talk about the next steps. So I would suggest that you review the full Workplace Learning and Support Framework. There are a range of introductory videos which talk about each of those steps and give you a little bit more detail, and that's the good starting point, is to actually just work through those steps one by one, and to also seek any support that you might need. So you can contact people who have been involved in the development of the resource, and those names are listed in the acknowledgements section.